Very good evening, Professor.
Okay then, good evening everybody. I think we'll start today's session. So first of all, may I say thank you to all for attending. Just to bring you up to date with one or two things, we now have quite a lot of speakers confirmed for the coming year. Some Indian speakers, some international speakers from all around the world. So I'm sure we're going to have an exciting program, and I'd like to thank particularly Rajesh for all the work he's been doing behind the scenes for making sure that we're all getting slots filled in this this program. We'll follow the usual format for tonight. So our speaker will be introduced by Rajesh this evening, who knows him better than I do, and we'll have the usual around about half an hour of presentation and then time for discussion and questions afterwards. Can I just remind you that it's important we don't interrupt the speaker during his presentation. So once we start, if I could ask everybody to switch off their microphones, mute themselves, then that's easier for the speaker to get on and give his presentation. So with that, I'm going to hand over to Rajesh and say thank you, Rajesh, for introducing this evening's session. Thank you.
Thank you so much, Richard, sir. Respected board members, respected members of IIRN, it is my privilege to introduce today's speaker, Dr. K.K. Dhanavendran. Dr. K.K. Dhanavendran, presently he is a faculty at NIEPID Secunderabad, and he is a lecturer in special education. Previously, he was working with NIEPMD as a special teacher in the cerebral palsy unit, and he has done his MAT and PhD in special education. He received Best Professional Dr. Rita Peshawari Award and Best Teacher Award by Rotary International, and the Best Special Employee at NIPMD Chennai. He did his Doctor of Philosophy in Education with special education, but particularly on social skills of children with disabilities, cerebral palsy and autism spectrum disorder in relation to their parental involvement. He has published around 9 research papers in UGC care journals and Scopus Index journals. So I would like to request Dr. K.K. Dhanavendran, sir, for his presentation. Over to you, sir.
अरे सुबह दीदी नहीं ले रही, दूध बना के दे रही हूँ, नहीं पी रही हूँ.
Sir, please give me one second, sir. I'm sharing my. The host is disabled. The participants is screen sharing, sir. Please allow me, sir.
Rikarjun, sir, can you just allow Dhanavendran, sir, to share his screen, sir?
Hello.
Yeah, yes, sir.
Sir, you can allow Dr. Dhanavendran, sir's screen share.
Still, it is host disabled participants screen sharing, sir. Please, shall I share to you, sir? If suppose. Still is it is.
Mallikarjun, sir, is there, so I think he will let you to share.
Okay, okay, sir.
Hello.
Sir,
Mallikarjun, sir, kindly please allow Dhanavendran, sir, to share his screen.
No, share. Anyone can share. There is no restriction. There is clearly it is visible share content.
Okay, sir. Dhanavendran, sir, now you can just click on the share screen.
Okay, sir.
And you can share it.
So still it is actually happening for host disabled participants screen sharing. I'm sorry, sir. I'm unable to share my screen.
Rajesh, who has the rights to manage the screen at the moment?
I think Mallikarjuna has. He says that it has been released, but
No, it's not been released. It definitely says host only when you try to look at the screen.
yeah, it's not released, Mallikarjunji.
No.
Shall I rejoin, ma'am? Shall I?
No, whenever,
No.
however it will help releasing
ma'am.
it, please do
Yes, ma'am.
that.
Yes, ma'am.
Otherwise,
Yes.
you have to take the PPT and you project from your end. Better you
Okay.
try rejoining and releasing it for him.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Sir, also, you can just send it to me so that in case if there is still any technical glitch.
Sure, sir.
It's
Sure.
open for Rajesh, is it?
Sure.
Rajesh,
Yes,
yours
madam,
is
it is.
open.
Yes, ma'am.
You don't have a screen share issue.
No, ma'am. Now it is host disabled. Now it is not
Again,
sharing.
disabled for you also. For me, everywhere it says disabled. If Rajesh is enabled, Rajesh can share.
Sharing is not disabled, madam. So sharing is not disabled. Sharing is on.
No,
No,
for
sir,
all
it
of
is
us,
showing.
it shows disabled.
It
Yeah,
is showing
it's
host
showing
disabled participant screen sharing.
disabled for all of us.
Just 1 second.
Rajesh, you were earlier sharing, no? That also got disabled now?
Yes, madam. Earlier I was able to share. Now it is.
Yeah,
disabled.
you were able to share, I noticed.
Sir, I'm going to send you that email, sir. Please. It's still host disable participant screen sharing. Only it's visible, sir. I'm sorry, sir. So, ma'am,
Or-
please forgive me.
For me also it is showing the same thing. Let me try. You just send it. Let me try.
Okay, sir. Okay, sir.
It is not enabling anybody. Even I'm trying.
Yeah, I have also tried. It's not enabling. Earlier, Rajesh was enabled. I don't know how it also got disabled. Rajesh did share the program
Yes,
and all
madam.
that.
Now also for me it is disabled. Earlier it was sharing.
Yeah,
I was able to share the details.
program and also the flyer for the today's.
Yes, ma'am. Now it is
You had
showing
put it
host.
on, I remember. Rajesh is the host now, it says. Rajesh, maybe you will be able to share now.
Yes, ma'am. Yes, ma'am.
But I have all settings I have.
Rajesh, can you now, yours is enabled?
Yes, madam. It is enabled.
Yeah.
Waiting for his PPT.
Dhanavendan anchitingla PPT. Dhanavendan PPT Rajesh kanapchitingla. Where is he? I see Kala Dhanavendan. I don't see him.
Rajesh sir, you make Dhanavedan also host.
Okay, sir.
But I can't see him.
can I simply mail you the presentation and you can share it from your end?
No, the speaker I'm not able to see, I'm saying on the
Kala Dhanavedan is there.
Kala Dhanavendan and Dhanavendan, two were there earlier.
He's there.
There was one Kala
Can we
Dhanavendan,
stop
one
the
Dr.
recording and then
Dhanavendan.
share? Might be then.
Sir, shall I go like this? Yes, sir.
Presentation mode.
Yes, yes, sir. You can go ahead, sir.
Yeah, I'm unable to make it, sir. Please forgive me that
Go ahead, go ahead.
because there's a little bit tension also I had. I'm sorry,
Go
ma'am.
ahead, sir.
Very good evening, all, and the great personalities in front of me in the online meet. Dr. Richard Rose, sir, one of my core guide, who was Dr. Himanshu Das, sir, who has guided me in this particular my doctoral dissertation, where I made it. And with your pardon, I'm sorry for that also, my delay, because it was not connected. That's what I didn't make it. Thanks a lot for giving me. It's a wonderful opportunity, ma'am, Dr. Jayanti, ma'am. And I would like to present you in front of my stalwarts, where the personal and social skills of children with multiple disabilities in relation to their parental involvement. Is I audible, sir? Rajesh, sir.
Yes, sir. Yes, sir.
Thank you, sir. Yeah, introduction to the personal and social skills of parental involvement. Parent participation and involvement in the education and training of the child hopes for improvement in possibilities, which makes them functionally able to do, and the mobility and self-care skills and socialization. And parenting is the most important skills that foster a child overall performance, where the child starts from the beginning 0 day to the child who is achieving 18 years of the school age and higher education, and to adapt the environment and function effectively and act independently. That is a primary motto of any parent. And the parents of children with multiple disabilities need a great deal of support, needs for their information about the child diagnosis when they are diagnosed, and further they're supposed to have a training, treatment, and how they're supposed to do a management services techniques to the child with their children with multiple disabilities, and the support services which is available in the society, community, government, and the school system. And about 10.63% of the children with persons with the disabilities which is suffer from more than one this type of disabilities as per NSSO 2011. And the personal skills related to those skills, abilities that enable us to carry out our routine everyday tasks or activities. It makes us the activities of daily living which I supposed to do it. The social skills refers to the development of the ability that enable the individual to behave in accordance with the expectation of the society. So both the everyday activities as well as according to the expectation which I supposed to meet it, I need to participate in the society. The social skills and personal skills are needed. Children with multiple disabilities as per RPWD Act 2016. It's a condition in which a person may have combination of hearing and visual impairment, which we know about that more than 2 types of disability. And here the multiple disability limits the child's area of his own development, where mobility, perform his activities of daily living skills, socialization, which they're supposed to do an interaction between other children or family members, communicating their needs, where he needs for his own physical needs, psychological needs, social needs, and ability to solve the problems, play and participation in recreational activities. These leads a severe educational needs and hampering them to cannot be accommodated in a special education program where the child with multiple disabilities is concerned. And the involvement of parents, which generally have known, I referred a book whose parent as a partner, volunteering at school, attending meeting, parents teacher meeting, and help children homework, attending school events, and so on. At the written, maybe it's unwritten task which related to the child overall development. As per Dr. Joyce Epstein, 2009, he proposed 6 types of parent incorporating the parenting, communicating, volunteering, learning at home, decision making, and collaborating with community. These are the most primary area where one parent who is having a child who is intellectually sound, who's supposed to do a parenting skills. These are the parental involvement skills, which related to children with the disability, which I adopted this 6 types of parental involvement in my studies. And the role of parent training, why we need to do the training program to reduce the dependencies. That's what we are promoting, the role of the parent training programs and improving the advocacy. They're supposed to understood what is available in the environment as the government is providing education setup and sectors, and the own community, what are the availability of resources which is for their children, preparing for them self. It is not dependency, self, motivating with knowledge, prefer to be standalone care for their child 24/7, wherever, whenever, whichever it is needed for their child. That's what parent training is most important. And related to, there are 84 combination of children with multiple disabilities, which is identified in IPMET, which I selected the study, children with cerebral palsy with intellectual disabilities and autism spectrum disorder with intellectual disability as a primary concern in my study. A CP, you know that it's a non-progressive group of neurological condition which affects posture, movement, and the muscles. And autism spectrum disorder, which we know that we all professionals that it's a neurodevelopmental condition which is arresting their children first 3 years of the life. This triad of impairment, which we used to say that socialization and communication, repetitive behaviors. And here how it could be affecting the children who is a child with normal, autism spectrum disorder, who have, there is no motor handicapping condition, and a child who is having a motor handicap, a child with CP, how they are, like association between that personal skills and social skills, how it is the developments affecting their daily day-to-day activities. That was a primary mode of my study, which I took. And the need of the study, which is, I already spoke that children with multiple disability face a lot of difficulties to overcome their personal and social skills due to their problem in physical, motor, cognitive, social, and communication. These skills achieved by the typically growing child as age appropriately, but children with multiple disability, they depends on their parents beyond the ages and beyond their developmental progress. All the parents of children with multiple disability, they depends on the professional expertise, which every child need their activity one another, and of like personal skills or social skills or physical motor skills, and any of the skills, their dependency is more for the professional expertise. When professional expertise not found in rural area and some of the urban area also, the trained professional level of the dependability level is increases, and the level of stress also increases, and the role of parenting is a question mark. And if the parent of a child with multiple disabilities were trained, they will look after their children on their personal and social skills, especially the studies focus. Their level of involvement increases, and children achievement level also increases. So they can measure their involvement, their progress of their children, if they know how to handle their children problems effectively. Hence, the need of the study was arised to identify involvement and train parents of children with multiple disabilities on their personal and social skills to overcome these challenges. The significance of the study, it is hoped that a result of the present study will contribute towards improving the parent knowledge and their handling and training their children effectively at home. Children's strengths and weaknesses assessed by the parents. That was a primary motive. When you do some training, you can assess your child and where he is, whether the child is in acquisition level, or he is in a fluency level, or he is in maintenance, or he may be in generalization, where you want to give a training program further he needed. The involvement of parents is the amount of support and to contribution by them to their children's school and overall development as per Althoff 2010. Parents commonly believe that if they trained in handling of social, the skills related to their children will definitely benefit more. Professional supports and it's ensured parents' presence and their participation in the decision-making process and in individual educational plan program. If they trained they require intervention skills. They will look after their children independently, where nowadays we are speaking about cross disability model, where all the professionals comes as a parent also take leads for their child program. The statement which I've given here, this present study, the researchers aim to identify the involvement of the parents, how they are training their personal and social skills, and their role, how they will be without any rehabilitation professionals, how they can develop their children, and the personal and social skills, which is include the personal skills, a set of skills like eating, drinking, toileting, brushing, bathing, dressing, and grooming. And the social skills are addressed here: social interaction, communication, listening, play, peer relationship, behavior management, problem solving, and health and safety skills of the both is taken care. Overall, it's 7 + 8, 15 skills. Normally, children achieve these skills at age appropriately, which I already told. But children with multiple disability, they need lots of training. However, these skills were addressed and trained by rehabilitation professionals as special educators or occupational therapists or speech pathologists and physiotherapists, where they will be giving a interdisciplinary model or maybe multidisciplinary or transdisciplinary approach, which we are doing it. Even though these skills fail to accomplish personal and social skills, the poor achievement of personal skills certainly limits their children's social skills. If parents were adequately trained, they will look after their children. The investigation was taken. Is there any relationship between involvement of parents and children personal and social skills after implemented the developed parental instructional strategies? The rational involvement of parents definitely achieve their greater importance of children. The parents greater benefits for children and family, and it reduces the stress of a family, an individual who's a mother or a father who and they achieve their children development. And educational policies focus the children with the disabilities and recognize the value of involvement of parents in home and school for their fullest part. And Ministry of Social Justice and Empowerment also, there are a skill with the module was include employability skills and life skills for people with the disabilities. And for professional, they have given a employability skills, and CBSE they have given a life skill module for growing children from the child who is starting from 6th standard to 12th standard. And like high support needs, who children have more than one disability with additional educational needs are dependent for their parents, because this a lot of that limitation in motor, social, personal skills, which is that their dependency level also increased. Parent role need to be strengthened to improve children quality of life, which nowadays we see speak about the quality of life of all children with the disabilities. Here also it's needed the importance. The study aimed to train parents, become a trainer for their children, trainer for training own child, and skills transfer to other.
Simple.
Operational definition, which is parental involvement, given by that involvement is a participation of both parents on child rearing activities that makes the child achieve his fullest participation, one or more related activities, and developmental perspectives. And it's mainly parental involvement. It is a participation on child care skills. Personal skills as activities of daily living skills means ability to care oneself, to live independently in the environment and everyday basis. These skills, which I already have told, that eating, drinking, toileting, brushing, bathing, dressing, and grooming. And social skills are that are needed to live in a society, to get help, interact meaningfully, and understand the social cues, to communicate effectively. As children with multiple disabilities, which have given us, the author was given the definition, which is means having a more than one disability in which affects his learning and skills. The disability affects the child personal, social, communication, cognitive, conceptual skills, academic, leisure, and recreational skills severely. And the delimitation, where present study is limited only, it was conducted, and the children with cerebral palsy and autism was selected. And there are 6 demographic variables of parents, which is their age, gender, which is less number of male were participated, and gender as related to age, education, socioeconomic status, locality, and occupation was selected. And children variables, which is selected to taken care. And the delimited only the personal skills domains like eating, drinking, toileting, brushing, bathing, dressing, and grooming. And the social skills domains related to social interaction, communication, listening, play, and friendships. Friendship skills like problem solving, and behavior management, health and safety skills. These are the 8 skills from social skills and 7 skills from selected for study. The theoretical background. Sir, is it audible? Shall I skip or shall I continue the same?
Sir, you can continue, sir. It is audible.
Yes, thank you, sir. Thank you, sir. Theoretical background. A trained parent provide the treatment in the home environment can be greatly reduce the child problems. As also the parent can work in conjunction with the child teacher or therapist to provide consistency in training. And training program that emphasizes general treatment procedures may enable the trained parents to handle any new problem their child may exhibit. The training of parents enhances the transfer of treatment gains to novel settings and behaviors. The reviews which is given here. A parent training is a method by which the parents are taught on handling with techniques and strategies to follow the instruction already established in theories of learning. Previous studies done on children with cerebral palsy and autism and their core deficit, mobility and related difficulties, and ASD of social communication and repetitive behaviors, but not the deficit in personal and social skills was exclusively studied. Children with cerebral palsy only studied on motor handicap condition, which is related to physiotherapists, where they have seen their spinal cord and mobility, limbs, contracture, deformity, like that. It was studied. And children with autism also, they have studied that there are number of studies, which is n number of studies which we found related to social skills, communication skills, and behavior related skills. And but it is not in the personal and social skills. Personal skills, not in excessively social skills. Therefore, the study aimed to provide training to parents to see the changes and achievement on their children's personal and social skills through parental instructional strategy. The review, which is collected, the review was collected from the peer-reviewed research papers. There are 26 intervention studies and 19 experimental studies, 10 survey studies. The literature scanning was done on parental involvement, personal skills, social skills, multiple disabilities, cerebral palsy, and autism spectrum disorder. The review of the study found children with cerebral palsy had mobility-related difficulties like self-help, toileting, eating, brushing, communication, and social skills. And ASD studies found that core deficit as social communication and behavior. There were few number of Western studies found in multiple disabilities. There were very few studies only found on parental involvement related to training, personal and social skills of multiple disabilities. Most of the studies found on academic achievement in single disabilities. To fill the gap, the investigator selected the study. The research studies included under different themes with personal skills of 32 studies and social skills were 13 and parental involvement on personal 7 and parental involvement related to social was 2. And further, children with cerebral palsy, motor skills has strong relationship between daily living skills deficit and gross motor function deficit. Because of that, mobility is affected and the children dependency level in daily living skills also is more. Studies also found children with CP has deficit in healthcare, cognitive, problem solving, communication, peer interaction, and friendship skills and problem behaviors. And children with autism spectrum disorder found lower score on daily living skills in personal hygiene, dressing, safety, and interpersonal skills. And ASD children, the core deficit contribute to deficit and adaptive function of ASD, Tillman et al. 2019. And children with cerebral palsy have limited level of participation in many areas of life skills like education, social skills, and recreation. Mostly the findings, the support studies found more number of these areas, children with cerebral palsy has education, social skills, and recreations. The objective of the study, to find out the personal and social skills of children with multiple disabilities, to find out the nature of parental involvement of children with multiple disabilities. Third one, to find out the significant difference, if any, in the personal and social skills of children with multiple disabilities in the parent and children demographic variables like their parents' age, education, socioeconomic status, locality and occupation, and children vary talk out and develop and validate the parental involvement strategy to enhance their children in personal and social skills, that effective parental involvement of children with multiple disabilities. The fifth one, to find out the effectiveness of the developed parental involvement strategy to enhance their parental, personal and social skills of children with multiple disabilities. Sixth one, to find out the relationship between parental involvement and personal social skills of children with multiple disabilities after adopting the developed parental involvement strategy. So to find out the personal social skills in children with multiple disabilities and find out that involvement of parent, whether it is low, high, moderate, or how the significance of the parental involvement which is affecting the child's development related to age, related to their gender and parental variables, and how we are going to do the instructional strategy, how it will be effective. The personal social skills of children with multiple disabilities and find the relationship after adopting the developed parental involvement strategy, which was the objectives. And the hypothesis, where there is no like null hypothesis was there, and there is no significant difference in the pre-test score of before training in personal and social skills in relation to the demographic variables of children and the parent. And there is no significant difference in the personal and social skills of children with multiple disabilities after adopting the developed parental instruction strategy in relation to demographic variables of parent as well as children. And third, there is no significant difference between personal and social skills of children with multiple disabilities before and after adopting the parental instruction strategy is related to child. And there is fourth one, and there is no significant relationship between the nature of parental involvement and the personal and social skills of children with multiple disabilities. As a null hypothesis was made. And the methodology, about a study population sample. The present study was conducted using survey quasi-experimental design to identify the parental involvement in training their children with multiple disabilities and their personal and social skills. The children, the parents and children were selected from NIPMED model school. And this present study selected 120 participants among 60 parents and 60 children. Among 60 parents from cerebral palsy background and 60 from autism spectrum disorder. Age range from 24 to 54 years, the mean age of 37.9 from the parents, and 60 children with multiple disabilities in the core area of CP with intellectual disability, autism with the intellectual disability, both male and female in the age range from 5 years to 19 years, which starts from primary, secondary, pre-vocational level was selected, and the mean age of 12.37 selected for the study. And these are the distribution of sample. Parents were, because of that, the gender related to male and female, we didn't do it. Even though study was, the analysis was done, but there is no changes in the male. And female were 57 parents. And children, male 43, female is 17. There is no correct number, equal number of study, children was found. And the inclusive criteria, children with CP, all type of like mild, like what do they say, like hemiplegia, diplegia, the severity with associated condition was selected with intellectual disability, and children with autism spectrum disorder, all types of severity with associated condition like intellectual disability was included. Exclusive criteria which found that children with visually challenged and deaf blindness was not included. This is the plan of phases of study, which started from the survey quasi-experimental parental involvement. We went to the need analysis was done through the face-to-face interview. And the left side, which you are, if you are seeing that the left side is a developed parental involvement was developed the questionnaire on personal and social skills. And the right side developed a functional assessment questionnaire on children, personal social skills was developed, and both the reliability and validity of the tool was done. And the pilot study was conducted. Based on the pilot study, the left side data collection of parental involvement questionnaire was pre was conducted. And the next level, development of training module was developed, adopted parental instructional strategy. And after that, the selected instruction strategy was developed implementation of training module on personal and social skills. And after 3 months, the parent involvement questionnaire was enlisted and ensured to get the their improvement through the PIQ post test. And the data analysis is done and findings was reported. And from the right side, if you see that after reliability and validity of the tool of children developed a functional assessment questionnaire on personal social skills, it was the data collection was done with the pre. And after the training, after 3 months, the functional assessment questionnaire of post was conducted with the children performance, and the data analysis of both children and parent was analyzed and finding was reported. The research design, which you can see a method, which as I already have explained about it. Sorry. The research tool about the parental involvement questionnaire, and it's a construction of with the personal skills domain, which are the 7 subdomains, which I already have explained about it, and social skills related to 8 subdomains, which is related to all the social interaction, communication, listening related to that. And each subdomain has 4 questions and 28 questions in personal skills and 32 questions in social skills, which are related to the PIQ on personal eating, drinking, toileting, brushing. That are 7 skill domains. 7 into 4, so 28 skills, and 8 into 4, 38 is questions in social. Totally 60 questions on parental involvement questionnaire. Each question has 2 responses, yes or no. It's a closed-ended question. Further, if they said yes, they have to elaborate that open-ended also is there to rate their involvement in high, moderate, or low level, or low or no. The numerical code starts 3, 2, and 0, 1 and 0 for no responses. And then functional assessment, which you can see the right side, tool 2, functional assessment questionnaire. The investigator also developed a self-constructed questionnaire on assessing the ability of children with multiple disabilities and their personal and social skills. There are 50 skills in each domain, like personal and social skills, overall 100 skills. And personal and social skills are arranged in the developmental based sequence 1 by 1, starting from birth to 19 years, with the help of the FACP and MTPS, which is how they are constructed. It was compared with the previous skills, which is helpful for the investigator. The tool 1, the validity, tool 1, tool 2, the validity, content and phase validity, and item analysis was done. The reliability split half method and the reliability of the PIQ was 0.98, and the functional assessment question was 0.84 on children. And the pilot study was conducted of 30 parents, 15 from cerebral palsy, 15 from autism. And the pilot study was done to see the duration of each parental interview, understanding of the questions by the parents, and the effectiveness of questionnaire, and to finalize the questionnaire. And the data collection was done through parental involvement questionnaire. Was conducted. Before conducting the interview, the informed consent was collected from the parents, and the study was explained to them, and it was the ethics also followed for confidentiality of the data which is collected from the parents. After the data collection, the investigator measured their involvement, whether the involvement is high, moderate, low, or no. And in relation to that after the terms which is used, whether they are regularly providing training to their children, or whether their concentration is good, or how high or moderate or low, or the training time spent to the children is a high or moderate or low or no, and whether they are preparing and teaching the children professionally after the training, whether it is high, moderate, or low, no. The results, the pilot study results evidence that the involvement found low to moderate. The investigator decided to develop a training module to train parents on personal and social skills. Further, the developed functional assessment questionnaire was used to measure the personal and social skills of children. The pre-test showed most of the children acquired the skills in emerging level. That's what it is a starting one, where the child was trained. There is a need for training to their parents on personal and social skills. The felt need for developing a module for the same was proposed. and the development of parent training module. These are the steps which is followed. Based on the pre-test finding, the investigator developed an activity-based training module for parents to train their children personal and social skills. The module has a step-by-step task analysis-based model developed in picture description, written in Tamil as well as English. The module has contented like need of the module, procedure to use the module, purpose of the module, domains of the skills which is personal and social, and the stages of learning for motivating them to plan, execute the activities. Further, the module has instruction to the trainer, materials to be used, and methods to follow the training and self-assessment by the teacher, and conclusion and remarks was included. And this is a model which is personal skills module, training in the personal skills, which is a skill to be identify edibles from the non-edibles, the objectives and the content, and the components also is there provided here, which is indicate his needs, whether each with hand, eat with curry, mixes with side dish, eats with appropriate side dish, and ask more if required, and follow appropriate table manners, and everything is starts from early to developmental sequences was added. And the task analysis also given with the investigator draw his own picture and he gave the task. And this is a social skill module which starts from the training component of social interaction. It starts from social interaction and goes further the other 7 skills. The skills, sub domains and the sub skills, which is written, skill, objectives, and the content, and the components of sequences of teaching with the particular domain, and that particular domain, each skills which is given here, the task analysis also, how to train. Each photographs is written, drawing was explained, and how to use also was described in the module. These are skills and duration was training to the parent. The personal skills, and each skill area taught in 1 hour 30 minutes per day for weekly thrice for a period of 3 months. It's a lecture on each skills on 30 minutes, sharing experience at 30 minutes, and demonstration of skills of 30 minutes was taken. Demonstration, PowerPoint presentation, group discussion was held. And implementation of the parent instruction strategy, the training was conducted through lecture method, which I said. Parent was assembled in a lecture hall, fitted with that LCD projector, and the skills one by one, it was explained to them. And the investigator presented the skills one by one as per the list arranged in the functional assessment questionnaire, which is the skills which should be taught to the child. The model doll and adapted devices, cut glass, wooden handle fitted brush, velcro fitted spoon, straw fitted tumbler, communication books, social cues, reward techniques, buttoning frame, etc. was used during the training program by the investigator. Each skill area taught in 1 hour 30 minutes per day for weekly thrice for a period of 3 months. Lecture on each skill 30 minutes. Sharing experience, which is already I've told. The handling technique, which is was addressed on suitable to whom modification was taught at the end of each session. And statistical techniques which is used and the obtained data have been analyzed by using the appropriate statistical techniques such as descriptive analysis, percentage analysis, mean, standard deviation, t-test, f-test, correlation was applied. The statistical package for social sciences version 16 was used for analysis. And then the major findings in the pre-personal and social skills of children with multiple disabilities. The emerging level, the children with cerebral palsy found 56.66 in both children with multiple disabilities like CP and autism, multiple disability generally, and emerging 56.66, and social skill 36.66, and dependent level of pre-personal skills 20, the pre-social skills at 31.66, and independent level comparatively is lesser than that. So 23.33 in personal skills and 31.66 in social skills and percentage analysis. And nature of parent involvement on pre-personal, and so this is related to pre-training. Regularity on children with CP and 23 point, and you can able to see that autism spectrum disorders 1% is increased, and concentration, which is the pre-test personal skills 26.14 and 25.29 in ASD. Time spent 24.14 and 25.86, and professionally training the children 20.00 and 22.57 in autism. And please to test social related to that children here, the both the little bit discrimination is among them, regularity as well as concentration, There's more concentration. Already they have more, we don't say that the parents of children with the multiple disability, they don't have any involvement. They have higher level of involvement, but the training was missing. That was a study which is I found, I'll report to you in another slides, which is the pre-personal and social skills of children with parents and children with multiple disabilities. The children performance in pre-personal and social skills before training, the personal skills level of achievement was low. That's what is hindering to put a training program, and social level skills level of achievement was low, and the involvement of parents were pre-personal high in regularity. Every day they are doing it. Regularity was more, concentration on eating, toileting, brushing, bathing, dressing, and time spent in toileting, brushing, and eating, and low in their professionally they are unable to involve because they have a limited exposure and experience in handling their children and personal skills. And related to the social skills, the involvement found high in regularity. Every day they do that. Regularly they train the children. Concentration was high, and time spent on training is more in social interaction, listening, play, peer relationship and friendship, problem solving, behavior management, and health and safety skills, and communication skills, and personal social skills, and low score, which is related to the gender as well as parent age range, education, and socioeconomic status, and locality, occupation. As per the instruction, which is Rajesh sir will be sharing you the PPT. Please, I am rushing to another 5-10 minutes. I'll complete this presentation. Related to hypothesis 1, the pre-test score on gender, related to the relation to the parent variables, and hypothesis 1 and the findings. There is no significant related to the hypothesis relation to demographic variables. The parent pre-personal social skills of parent. There is a significant difference, involvement of mothers, because actually for father involvement, maybe because of the study which is we found less number of father was involved. Here the mother role is highly high involvement was found, and there is no significant difference in the age and education, socioeconomic status, and locality, which the involvement is higher or low. The pre-social skills of parents, there is a significant difference involvement of mothers, really that their involvement, and there is no significant difference found in age, education, socioeconomic status, locality, and occupation. Both pre-personal and social skills comparatively, it looks that age, education, socioeconomic status, locality, occupation mean score had high, and that pre and personal, post-personal skills, social skills related to age 41 to 50 or above 50, they have involved more. And education related to post-graduation, they learned more. Understanding level was more, and they have involved more. And socioeconomic status, which the third category, which they have, because they spend money, they can go for offering the child therapy services. And locality, who is living in semi-urban, they are acquiring more individual therapy and support for their children. And occupation, who is housewife, who more involved in training their children. And these are the pre-test score related to before training in children. That's a findings. Pre-personal children, there is a significant difference between the gender, which is male, and female, which is the gender diagnosis, and the parental involvement. Personal skills pre-test, there is no significant difference between that age, severity, associated condition of the children, and their parent involvement in personal skills. There is no significant, because related to age or severity, because a child is a child, they are providing utmost care, the pre-personal skills, which is saying that. And we'll see that after training how it happened. And that's a social skills related to the final last one. You can see that green one, pre-personal and social skills of children. There is no significant difference between age, severity, associated condition. Mean is high actually. There is no significant difference, but the mean score is sky. The pre-personal skills, pre-personal and social skills related to gender, female had higher involvement. Children with the female gender had high involvement of parents, and age group 15 to 19 had more involvement. And diagnosis of children with the ASD parent, they had more involvement in pre-skills, pre-personal and social skills. Severity, severe and mild category, they involved more. And severe category children were intellectual disability with the other associate condition was parents of involvement was higher in pre-personal and social skills. and this is related to hypothesis 2. There is no significant difference at the personal and social of children with multiple disabilities. After that, this is called after training the parent and instruction strategy related to the variables of the parent variables. Here, you can your left side, post personal skills of parent. There is a significant difference between gender of the parent, which they mostly mother's involvement was high. Comparatively, the father was less involvement here found, which is we had very less number. And post social skills of parents, there is a significant difference between gender. Again, I was supposed to quote it. And both personal and social skills, there is no significant difference which is found in the age related or educational related socioeconomic status and locality and occupation. The gender only, it was majorly given evidence for involvement. And post personal and social skills, there is the post personal social skill related to gender, female involvement is more. Age between 41 to 50 and above 50 was involved high. And education related to PG and secondary level who understood the techniques and they are providing the services to their children. And socioeconomic status, which is related to the third group, which is 10,001 to 25,000 had more involvement. The locality related to semi-urban, which is previously we have found that pre-personal social skills also the same was found. Occupational skills, housewife are involved more, had high involvement in their children training. This is related to children. There's a hypothesis, another one. After adopting developmental parent instruction strategy, relation to children, gender, age. It is related to children. How after the instruction strategy was given, how the children achievement was. The post personal skills of children, there is a significant difference between children, gender, diagnosis, and their parental involvement in personal skills post test. Related to that, there is this related to children, gender, diagnosis was increased their involvement, and there is no significant difference which is found age, severity, associated condition with the personal and social skills. And right side, you can see that post social skills of children, there is no there is a significant difference between the children, gender, and diagnosis. Here, both the post personal skills and social skills, gender and diagnosis made their involvement more. And the age, severity, associated condition mean score is high. Post personal and social skills related to gender, female had more involvement than male. The children was attended by the parents who they had a child female. And the age range 15 to 19 years and 12 to 14 years of children, they got more involvement by the parents. And diagnosis of cerebral palsy, parents had more involvement than ASD parents. And the severity, profound children had parents of profound children, they had more involvement than moderate. And associated condition, intellectual disability with other conditions like fits or other associated condition had high involvement. These are the the eating skills, which is all the domains, which is domain wise statistics, and just skipping this. And personal and social skills related to before and after adopting the parent instruction strategy, what has happened that, and related to the previous one, there is significant difference between the personal skills of eating, drinking, your left side, drinking, toileting, brushing, dressing, and grooming of children with multiple disabilities before and after adopting the parental instruction strategies. There is a difference. There is no difference in found was building skills. In related to social skills, there is a significant difference between the social skills of communication, listening, play, peer relationship, and friendship skills, problem solving skills, and health and safety of children with multiple disabilities. The parent involvement before and after adopting the parent instruction strategy was improved high. There is no significant difference between the social interaction and behavior related to study, which is less. And the nature of parent involvement here, the personal and social skills of children with multiple disabilities. The independent variable related to parent involvement and personal skills. The R value is 0.509. Statistically, I am poor because I'm just presenting the numbers. And P value, it's significantly shows that there is a significantly involvement is higher than this 000 level. And parent involvement related to social skills 0.344. It is the reliability is more on 0.007. The significance between the nature of parent involvement, The correlation analysis found that there is a strong relationship between the selected variables, namely parental involvement and pre and post personal and social skills of children with multiple disabilities, high after adopting the parental instructional strategy, and statistically it is significant. The pre and post personal skills are is equal to 0.509, and pre and post social skills is R is equal to 3.34444. Sorry, 0.344. The level of significance is p value 0.05. Hence, the null hypothesis is rejected. It is concluded that there is a significant relationship found between parental involvement and children, personal and social skills. And the discussion here, the previous study supported the present study findings that the parental program improved mothers were trained their children better in planning activity techniques and participate effectively in teaching personal and social skills of children with multiple disabilities. And the finding evident that elderly parents had high involvement after training program. It may be because of their new experience, they update their handling techniques. After the training program, parents had better understanding and they equip themselves in handling their children. And PG, postgraduate level parent had high involvement and involved their children education and training more. It's related to the study also Deering et al. 2004. And family background and educated parents involved better with present and previous training knowledges. And in response to parental locality and the involvement of semi-urban group of parents involved high in both personal and social skills, it may be the availability of services, resources in the community or nearby their locality, easy to make frequent visit, availability of the adequate transport facilities, and children's severity made them to involve high. And the previous study support the finding that socioeconomic status play positive outcome on children development and parental involvement, according to Griffith 1996. And the parent occupation related to housewife had high involvement because they had a lot of time to involve their children for their activity. And employment also can be an impact on parental involvement. Parents of high socioeconomic status and well-educated are often involved in children activity. And that discussion here also, the findings high in girl than boys. Previously, Gronlich et al. Was presented. Soon after adolescence, they achieve puberty. This is the most important where because the parents involve more in girls, female children. And this is a major challenge for girls with cerebral palsy, which I found that most of the children with diplegia or quadriplegia after puberty, the parents' level of involvement is more and challenge for training their puberty related skills, so that they want to make them independent personal skills to fulfill their physical needs and socially well accepted to communicate their needs to other was the primary motto, other than anything primary motto that may be their high involvement. And the present findings continued with the past study that the parent involvement is increased from secondary level to pre-vocational because they need to be independent in when they leave from the world. If then there is a last breath by the parent, how the child supposed to be independent in his life. That's what more involvement was there from 8th grade or maybe pre-vocational level to high school transition, soon be adult. Due to this involvement of parents, both personal and social skills are more involvement was found. The present findings, which is your right side, which is third one, supported by the previous study done by these authors, where that the parents of children with cerebral palsy had high involvement due to their limited motor functions. They failed to achieve personal skills and communication restriction, made them to prevent skills, that limitation and due to the inability in communication skills. And children with autism, down your left side, the present findings related to child with autism involved high in social skills due to the behavioral issues, lack of understanding of situation, poor communication challenges, and poor or more communication challenges, poor social interaction, poor problem solving ability, and lack of peer relationship and friendship skills. Parent experienced high caregiving demands and higher level of stress and depression compared to parents of other disability, because children with autism parents, they have a more levels of stress and anxious to carry every time. When the child is with a child with autism who asks a question to a mother, mom, when I was asleep, you are waking up. When I waking up, you are you are awake. When do you sleep? When do you fall asleep? This was the question with autism to her parent, because they are 24/7 every time they awake for a child with autism. They won't rest. Previous study found that the parental involvement high in children with high risk and special need children, and parents are highly instrumental to teaching social, motor, child behavior and other skills. And present study evidence that the parent of severe to profound level had high involvement, and previous findings support that the children's severity impact parental involvement and high parental involvement in children with severe disabilities. And personal skills related to the personal and social, it is revealed that the parent involvement high in children with personal skills, eating skills, most challenging one, eating, brushing and toileting skills, followed by other skills, and motor impairment related to sensory issues associated with condition, severity of the disability, but prevent them to participate most of the personal skills. And ASD children found low in daily living skills on personal hygiene, dressing, safety, interpersonal skills, and deficit in grooming, hygiene, feeding, bathing, and toilet training, adaptive social functioning, adaptive communication. Focus on personal care skills makes children self-autonomy and greater independence. So achievement of personal skills ensure their satisfaction of basic needs and independence in home and school environment. In social, it is evident that the parent involvement on training their children's social skills high priority seen in health, safety skills, listening, peer relationship and friendship, play, communication, problem solving, social interaction and behavior modification, because to make them independent in social environment. Previous studies support that more attention and the family priority was healthcare, self-care skills and communication, peer interaction. This it was supported in study. We also found, and the other studies also supporting the findings. And there is a strong relationship between personal and social skills studies. Evident that the lack of toilet training will impact negatively significance in children's personal skills, personal physical comfort, social isolation, and reduce their community participation, because social skills, personal skills, which is leads leading to social interaction and social skills. If he is not trained, he will not be accepted in the social environment. And previous one, because I know I can skip that. And here it's related to training. Parents' active role in the process of intervention makes using video modeling, pictures, visual schedules, reward, technique strategies, role play, peer tutoring, demonstration, training programs. It was the training program is more important for the parents of children with disabilities to reduce parental stress, improve parent and child interaction, knowledge about their children, diagnosis, and better understanding. So, if the previous as an instructor for their children through various training method like home and group training, and parent training modules and training primary caregiver on intervention to children with the disabilities is always effective. The study evident that training was effective and the training was a predictor for their children achievement as well as the learning. The recommendation of the study, it's a recommending that to improve the children personal and social skills, father, siblings and grandparents should be involved in providing training, and home-based teaching learning materials on handling children should be provided. Developmental domains should be prepared in regional language and distributed for training. Parents of children with autism spectrum disorder and additional disability should be provided pictorial illustration training manuals. And right side, basic or advanced training on identification and skills transferring training should be provided to all parents on handling children with multiple disabilities. Counseling and mental health education program should be provided through offline or online during the demonstration if the program fails and children achievement deteriorates. And personal skills with adapted and modification on training should be provided for parents of children with cerebral palsy with additional disabilities. Then the implication, which is personal skills, most important skill for independent living. Children with multiple disability depends their parents always, and in their everyday skills. Personal skills demands parents' full involvement and dedication. The training increased parent involvement on handling them, their personal and social skills. Poor intake of water and nutritious food will reduce the bladder and bowel difficulties, and malnutrition increases the risk of anemia and cerebral palsy children. And children with autism in the Down as a developmental disability due to their social and personal skills deficit, they are unable to spend time with their peers. Poor understanding, lack of ability to understanding and multiple social cues will lead the child to anger, decrease aggressive and show behavior problems. They misinterpret the social cues and need help for problem solving in emergency situation. The study helps parents to cater the needs of personal and social skills of children. The training module will enhance and increase the ability to train their children personal and social skills among all the children with disabilities. The implication is a slower, the multiple disability has slower progress, regression of learned skills, greater number of causal agent, have higher level of nursing medical needs, higher level of physical care, more one-to-one services, need more service provided to be involved, need for greater environment adaptations due to sensory and physical problems, need more adaptation and assessment procedures, need more adaptation in teaching methods, and need more adaptation in communication approaches. So the limitation, the investigator found that they has focused on personal social skills and their involvement, and the study present study was less number of reviews on personal and social skill studies and multiple disabilities. And the study faced difficulties to find out reviews related to parental demographic variables and involvement related to parents' personal and social skills. Present study also has not included children with the deaf blindness and visually impaired children. The investigator unable to include fathers of children with multiple disabilities because the primary caregiver was a mother. Most of the children who comes to school. The study was not included parent of early intervention level and vocational level. The investigator also found that the counseling of parents of difficulties to counseling the parents of severe and profound multiple disabilities. And suggestion, which was comparative study, may be conducted in a larger group, and study may be conducted to find out other personal social skills in older children with multiple disability, both the urban and rural area, both all the family members and the father involvement. Study may be conducted, develop a specific assessment tool for assessing personal and social skills in children with multiple disabilities with sensory problems and other skill deficit. Study may be conducted on different training methods like personal and social skills and training their children and parental involvement. Study may be conducted on other older children with CP and ASD on their parental involvement. And related to social skill and personal skills intervention strategies may be focused on adults, women with multiple disabilities. This is my conclusion. The study concludes that involvement of parent and children personal and social skills strongly positive, and there is a relationship between the variables of involvement and children with multiple disabilities, personal and social skills, and the adapted instruction strategy training was highly effective. The study is sufficient to the children, significant to the children with multiple disabilities and the present parents of primary, second, and pre-vocational level. Also, the study concludes that parents are the primary care provider for any child and children with the disabilities. They provide high support always, each and every developmental level. With regard to children with multiple disability, they need pervasive support, and that to lifelong care, parent involvement will be high even with or without training. Training guide them to understand better about their child disabilities, resource mobilization, and make them as a primary service provider and willing to accept as a multi-therapist. In this regard, training is important for sustainable development of children with multiple disabilities. Improving parental involvement, linkages with government, legislation, policies, resources, and public awarenesses, local education related to the policies, procedures, and resources in local education, the policies, activities, evaluation, and feedback related to school program, and the teachers who their knowledge, competency, skill, and action makes the parent as a partner, identify their barrier, involve them, train them, and make them to achieve their children's skills. Thank you so much.
Thank you so much, sir. Sorry, sir. Actually, Richard sir had an urgent meeting, so he left the meeting.
Sure.
Now, maybe we'll request Jayanti ma'am for her comments, please.
Very well done, Dhanavendran. But your whole thesis, you made us all listen. It could have been little more condensed to sustain interest of everybody. But it was 60 slides within this given time. Lot of information you gave. Fantastic it is. Probably one further study for you I may suggest, or anybody can do, is we keep saying parent, everything on parent. Their stress levels also are very, very high. Therefore, some kind of parent respite studies. Your same study, select a small group of parents, go in depth on a qualitative. You have gone through Richard Sir's qualitative research method classes also.
Yes.
So therefore, from your own sample that you had as parents, select a few of them and do a qualitative study on how they feel about having this burden of having to take care of this child with a multiple disability lifelong, and what is it that we can do to give them a respite care. See, you have proven very beautifully that parents' role is very important, and your SPSS package analysis also has shown that yes, it does work. But yeah, we also need to see the parental health, emotional health.
Yes.
See, this is a lifelong load on them.
Yes.
So probably as an extension of this study, if you take up something, you